Hello, this is Dr. Venkat Mysore, consultant dermatologist, hair transplant surgeon at Venkat Center for Skin and Plastic Surgery, Bangalore. I am talking to you today about when to do hair transplantation. What is the age at which it should be done? Are there any problems in doing it in young age? Or are there any problems in doing it in elderly individuals? These are the issues that often patients ask us. When it has to be done, obviously, being a cosmetic surgery, it has to be done when a patient needs it or he needs it most. And this is usually, for most people, in the third decade, towards the second half of the third decade, after 25, to the beginning of the fourth decade, 32, 33. This is the age at which they have finished their education. They have probably got a job. They are looking at prospects of marriage. They have their own money. They don't have to depend upon their parents. And they are also looking for progression in career, social standing, migration to some other country. So this age is the age at which most commonly people come to us. But what happens if a person is significantly bald at 20, 22, 23? Or what happens if somebody wants, for whatever reasons, personal reasons, professional reasons, at 55, 60, 65? Can it be done? Yes, it can be done with certain caveats, with certain qualifications, with certain reservations. Now, let us look at a very young person. Baldness these days is starting earlier than before. We are seeing patients who are thinning at 16, 18. We are seeing patients who have significant areas of baldness at 20, 22. Now, the problem is if you do a first transplant very early, 22, 21, then that person may not be emotionally mature, number one. Number two, that person may not comprehend that this is a progressive condition. He will become further bald, and to prevent that, he needs to take medicines. He may not be keen on taking medicines. Young people do not want to take medicines. Or he may feel that drugs may produce side effects. For whatever reason, he may not take it. Then if such a person gets a first transplant 22, by 25, 26, he will have balded again. He needs a second session. By 28, 29, 30, he may need a third session. This is a disadvantage. And he will also become very unhappy with repeated transplantations. On the other hand, if he gets transplantation at 60, 26, 27, 29, 30, he gets married, and as it happens in 90% of the individuals, he may not bother about further baldness at all because his purpose is served. This is one reason why we are hesitant. The second reason is it is more difficult to predict the future course of baldness in a younger individual. Will he bald in the front? Will he bald in the vertex? Will he bald everywhere? How fast it will bald? Very difficult to predict. So for this reason, most doctors would like to delay the first transplant at least till 24, 25. However, this does not mean that you can't do it earlier. It is just that the case should be strong enough to overcome the disadvantages that I mentioned. Now, for example, if at 21, a college going boy has so much baldness that he is being teased, trolled at college, and he gives up education, then obviously he can't be told to postpone transplantation. Likewise, if somebody is planning to get into a career such as modeling, television, acting in movies, then again we can't tell him to wait for 3 4 years. He may lose his career otherwise. Likewise, in some other cases, person may be so much affected psychologically that he may discontinue the education if he is not transplanted. This actually happened in a patient of mine, a doctor's son, who ran away from the hostel at 20, third year engineering. He said, I will not go to college unless I get some hair on my head. So these are special situations. In these special situations, each case has to be judged individually. A discussion has to happen with the patient and preferably also with the parents. Not just once but 2 3 times. Patient should be made to understand all aspects, including the need for taking drugs and understanding that he may need a second session or a third session. And then only one should venture into a transplantation. In such cases, it is preferable to do an FUT first because that will preserve the donor area better, and he can do an FUE in the second and third session. He will still have beard and body hair for the fourth and fifth session if necessary. And patient should be advised adequately about diet, about smoking, about drugs, etc. Now let us go to the other end of the spectrum. Can it be operated in elderly patients? Is there any disadvantage? As long as they are healthy and as long as they have a good donor hair, there is no problem. But old age itself can sometimes cause problems. People above 70, their blood supply is less. They may not get such a good response. Their donor area may be very poor. So in those situations, special counseling has to be done. Adequate testing with respect to medical condition has to be done. Physician's opinion has to be taken. And then a small session can be attempted initially. Then subsequently a larger session can be done. People in the age group of 50 and 60, they are otherwise healthy. There should be no problem in operating them. But these people frequently have heart condition. They are on anticoagulants. They may have diabetes. And in such situations, a physician opinion has to be taken. Clearance has to be obtained. And then only one should go ahead with the transplantation. So it should be treated like any other surgery in that situation. If they have a good donor, they will get good results. That is how these cases are handled. There are no great risks in transplantation as long as it is done properly. That has to be explained to the patient properly. And what the patient can expect should also be explained. It should not be taken lightly. It should be taken like any other surgery. And surgery is a surgery, whether minor or otherwise. So in brief, transplantation can be done at any age, though it is preferable to do it in the second half of the third decade and fourth and fifth decades. It can be done in the first half of this third decade between 20 and 25 in special situations. Elderly patients after 55 and 60, medical condition has to be screened properly. Very senior people above 70, 75, in addition to medical condition, their donor area has to be tested. They are likely to have a inadequate blood supply to the scalp. Outcome may not be that perfect. That has to be kept in mind. This has to be explained to the patient. So as always, transparent consultation, honest explanation, under promising and over delivering is always the dogma, always the method in hair transplantation. Thank you very much.